Hi, my name is Tina, your surgical scheduling coordinator. My team and I will be guiding you through the process of getting you set up for your upcoming surgery. Our goal is to make sure you fully understand all the steps and that all your questions have been answered. Your ophthalmologist has recommended surgery as the best option for your condition after discussing all the risks, benefits, and alternative therapies. Although this has been chosen as the best course of action for your condition, there is no guarantee of the surgical outcome.
Light rays enter the eye through the cornea, pupil, and lens. These light rays are focused on the retina, the light-sensitive tissue lining the back of the eye. The retina has two areas, the peripheral retina, which gives us our side or wide-angle vision, and the macula, the small area at the center of the retina. The macula gives us our pinpoint vision, allowing us to see detail clearly. The inner eye is filled with a clear jelly-like substance called vitreous. As we age, the vitreous becomes less like jelly and more like liquid. Usually the vitreous is only loosely attached to the retina. So as the eye moves, the vitreous moves away from the macula without causing problems. It's important to follow your ophthalmologist's instructions so your eye will heal properly. As with any procedure, there are risks of side effects and complications with vitrectomy surgery. These may include bleeding, eye infection, retinal detachment, new or recurring scar tissue inside the eye, clouding or scarring of the cornea, clouding of the lens of the eye or cataract, a droopy eyelid, increased pressure in the eye called glaucoma, vision loss, and the possible need for additional treatment, including medication and surgery. Also, your eye problem could remain or get worse. Be sure to keep all appointments with your ophthalmologist after treatments. Also, if you have any changes in your vision, you should call your ophthalmologist right away. Monitoring your vision is a vital step toward the goal of preserving your sight.
In each consent, it explains that other physicians, medical students, and/or qualified surgery staff may assist in the surgery. However, no individuals will perform tasks outside of their scope of practice. Here it explains the risks of general anesthesia and spinal or epidural anesthesia. This does not pertain to your procedure. On rare occasions, we will have a patient that needs general anesthesia, but for the vast majority of the cases the surgeons perform, they use a minor anesthesia care approach, meaning you are given a combination of a local anesthesia along with mild sedation. During your procedure, unforeseen conditions may arise. By signing this consent, you authorize your doctor to perform any additional procedures that are in his or her judgment deemed medically necessary due to any unforeseen condition. You agree to allow the hospital or surgery center to dispose of and/or study tissues or fluids that may be removed during your procedure. You consent to any medical photography for educational purposes by the hospital staff in which your identity will not be revealed. You consent to the administration of blood or blood products intraoperatively in an emergency situation as deemed medically necessary by your surgeon or anesthesiologist. You give permission for physicians, nurses, medical students, interns, or residents observing as part of the educational process approved by the hospital to be present. At the bottom of the consent form, there is a line for you to sign your name. By signing, you acknowledge that you understand and agree to the terms and conditions we just discussed. If you have any concerns or further questions, please let us know right away so we can address these with you. My team and I look forward to working with you and making this experience as easy as possible. Either I or one of my team members will be contacting you soon to get this process started. Please feel free to contact us at any time with any further questions. Take care.